My grandfather died of stomach cancer. This was one of the reasons why I became a medical oncologist. My grandfather, born in Japan, had a daughter born in California. My mother, who later developed colon cancer, a disease more associated with a Western diet. What can we do to decrease our chances of getting cancer? I had the privilege of sitting down and talking with MD Anderson Cancer Center professor, Dr. Lonzetta Newman. We have a conversation ranging from the advantages of a plant-based diet to HPV vaccination. We did not get to cover the connection between exercise and cancer. So here is a quote from the MD Anderson Cancer Center website. Quote, "Regular exercise is one of the best things you can do to improve your health and lower your risk for many cancers. This includes colon, breast, and uterine cancers. And if you're a cancer survivor, exercise may lower your risk of recurrence." End quote. Stay tuned to meet the personable Dr. Lonzetta Newman.
Baransu Balance Podcast with Dr. Ince emphasizes the interdependence and importance of a healthy mind, body, and soul.
Hello, welcome to another episode of Baransu Balance Podcast. Today I have a guest that I'm so excited about, Dr. Lonzetta Newman from MD Anderson Cancer Center. She is an associate professor of medicine in the Department of Clinical Cancer Prevention at MD Anderson Cancer Center. Today, we are going to answer your questions about what can we do to prevent that dreaded disease, cancer. Now, as many of you know, I am a medical oncologist and trained many years ago at MD Anderson Cancer Center. So I was so excited to meet and finally be able to speak with Dr. Newman. Welcome.
Welcome. Thank you for having me. It is such a delight to be with you. And I guess since the last time we have been updated, I am a full professor now in the Department of Clinical Cancer Prevention. And I am happy to be here to share all the goodness of what we can do to prevent cancer and all the lifestyle modifications that we might be able to help reduce one's risk of developing cancer.
Okay, wonderful. Well, I want to dive right in to my first question, and that's about the relationship of diet and cancer. As a lifelong vegetarian, I've had a long interest in this subject, but just a quick background. My husband had cancer, advanced lung cancer, and he was treated at MD Anderson over 15 years ago. And we, at that time, we looked at everything in our lifestyle, and I came to the conclusion that I was an unhealthy vegetarian because, you know, vegetarians, they can eat lots of pasta and dessert. So let's dive right into that. There are a lot of diets out there, ranging from the Mediterranean diet or low carb diet. Is there a general diet that you would recommend to decrease the risk of cancer? And if you can add a word about obesity while you're at it.
Sure. Well, you know, diets come and diets go. So I prefer to use the term nutrition. What is the best nutrition source that we have evidence to say this would help reduce cancer risk? And if I had to pick one nutrition plan, it probably would be more in line with the Mediterranean diet, such that a plant-based diet or plant-based nutrition would be most optimal. There are a number of different sources that are supported in those efforts, including the American Association for Cancer Research, and one that I really like in terms of color, the Power Plate plant-based nutrition, where it focuses on fruits, vegetables, grains, and legumes. In particular, it gives you a list in each category and how each of these categories might help to reduce your risk of cancer, diabetes, hypertension, cardiovascular disease, and diabetes. And if we looked at health in terms of chronic diseases, all of those that I just mentioned can be considered chronic diseases. So I think a plant-based diet where we are focusing on a variety within fresh vegetables, fruits, grains, I think that would offer us the best in terms of overall health. Now, you asked me to spend a couple of moments talking about body mass index and obesity. So obesity, as defined by body mass index of 30 and above, can be a risk factor for a number of cancers. That includes breast, uterine, ovarian, colon, pancreas, gallbladder, kidney, just to name a few. And that is without any other risk factors besides one's body mass index, which is their weight in relation to their height. So if you had to pick an area that you could focus on, it would be to focus on that to obtain a healthy body mass index. And I think, though not designed for that purpose, the body mass index can give you a good starting point of some areas in which you can focus on. But I do agree, and with your statement about there are unhealthy vegetarians out there. But I think if we focus on eating the way nature presents the food to us, that would help in terms of good starting points for reducing our risk of developing cancer and other chronic illnesses.
Okay, so we're going to challenge our listeners the next time they go to the grocery store to reach out to more colorful plant-based choices.
Yes.
And then if they go with the meat, use that more as a condiment,
So I like
a
to tell
side dish.
Yes, I like to tell patients
Mhm.
everything that I did not mention should be used as celebration foods. Something
Oh,
you
okay.
indulge just in that celebration. You don't bring it home. And
Okay.
that's a nice treat. And I think if you cultivate it that way, most of the days out of the 365, you would follow a healthy plan. And
Okay.
so celebration foods is what we should utilize everything else as.
Oh, okay. So um I have a daughter in Orlando, and as a daughter of an oncologist, she's privy to all of the things that I'm telling her that can cause cancer. And she has a question.
Okay.
There are so many carcinogens out there, and I agree with her. The pollution in the air,
Mm-hmm.
the pesticides
Mm-hmm.
in our plants, and now even the water, all those nanoparticles don't make me too comfortable. So, can you say a word about that? Is there anything that doesn't have listed as a carcinogen, or do you have any words of wisdom um, to leave with us about this subject that seems like everything causes cancer?
Oh my gosh, the list is never ending, right? And so I think, unfortunately, we live in a world with lots of pollutants from the air to the water to the foods, because the foods are being grown in areas where there are pesticides that are infiltrating and eroding into our water systems. So I think one healthy way to look at it is we have an environmental protection agency that is for the American people that we have they have a responsibility to maintain water quality standards, regulations, and resources for us. I think in the climate that we are living in, it is particularly important for us to hold all leaders accountable for all of these measures because we are suffering from years of runoff from pesticides, et cetera. And we need to hold everybody accountable to that, including ourselves. So what can we do? We can minimize the use of pesticides, start growing our own foods. And when you're growing your own foods, such as dark leafy greens, you can utilize garlic next to that or onions. All of those different things can help to minimize the use of any pesticides because they are natural ways of minimizing bugs and insects from your crops. So I do think that we all have to get back to nature, meaning growing your own foods, controlling all of the elements that you can control. And I know it sounds harsh based on if someone's living in a major metropolitan area, how can they do all of these things? You know, people are growing in pots on the balconies, etc. I think we have to be ingenious and start thinking about this differently. I am grateful and hopeful, though, because every day you see that the next generation are thinking about this in a different way. So I think it behooves us to hold everybody accountable, including ourselves, and to make the best possible choice given the circumstances we're all living in.
Okay, so what you're saying is that just don't, wave the white flag and say, I give up. I'm just going to eat anything and everything and
Yes, don't give up.
and live in the smoggiest city that I can find and drink all the water in the plastic bottles. But to be involved and to
Yes,
be aware of that, it's still best to be as natural as possible, to get out in an area, if possible, away from a lot of traffic, and to try to avoid the pesticides. And know some of the organic vegetables can be on the pricey side. For me, if, for instance, I'm going to, and I don't do it very often, but let's say, for instance, I want to juice carrots, I would choose organic carrots just to try to limit the amount of extra things.
chemicals. Yes.
That's just me. But
I agree with you. And I also would like to state shop local. Sometimes in your local areas, there's a farmer's market where people are growing things on a smaller scale than that in the grocery store. But if you get to know those people, knowing what they're doing, how they're processing, how they're growing their crops, you can form those relationships and you buy from them and you're eating seasonal as opposed to, you know, going in the grocery store and being able to get anything all year round. I think
okay,
this would help us to eat more healthy as well as more seasonal. And that would give you a natural variety because everything doesn't grow all year round. So you have certain things that grow in winter, certain things that grow in
okay,
spring, etc. And I
okay.
think if you did it that way, you would get a natural variety based on what nature presents as what's good for us at this time of the year.
Okay, and we also want to keep our skies as blue as possible.
Yes. And as
My,
many
my,
trees and
my,
green grass.
yes, and again, my husband, who wasn't a smoker, had lung cancer, and we lived in Houston for many years, and we moved out here to more rural area where the sky is usually always blue. So, All right.
One other thing about pesticides and the pollutants, I think one other thing that for for people who are working in jobs where they are exposed, hold their um, employers accountable as well. In the past, you mentioned your husband, there were not as many regulations on wearing masks and certain kind of equipment based on whatever your profession, your job is. I think that is important to ask those critical questions to your employers as well. And it's their responsibility to help in that regard to wear the best possible equipment for minimizing your risk while you're at work.
Okay. All right. So I have a listener from New York, Renee, who's asked about the percentage of people getting cancer from genetic factors.
Mm.
And sometimes families are reluctant to share their health information with family members. And so, and does this inherited type of cancer vary by cultural background? And when should you ask your physician for genetic testing?
Oh, that's a very loaded question, right? So let us spend a little moment defining the hereditary cancers. Those cancers that are hereditary, meaning as defined by genetic mutation in families that has been passed along, only represent, depends on the study that you utilize, anywhere from 5 to 13% of cancers. So if we just look at that range, the majority of the people that are getting cancer don't have a genetic mutation associated with that. That means that environmental component as well as lifestyle modifications might be of utmost importance. However, those that do get, which are the smaller percentage, a hereditary cancer, they do have a genetic mutation which predisposes them to developing specific cancers and at a higher rate and earlier than that of the general population. So, for instance, in a family where multiple people have developed a variety of cancers, but younger than the age of 50, that is a red flag for a physician to say, maybe there is more to this, and maybe that person should have genetic testing. If someone has had multiple cancers within a given individual, that is also a red flag to say perhaps genetic testing is indicated. I do think with all of the social media and the tremendous amount of knowledge that we have with technology at your fingertips, there's more talk about genetics and hereditary syndromes, but they still represent a small number of cases with regards to cancer diagnoses. Now, let us talk about, I think you also mentioned the caller asked about, or the listener asked about cultural backgrounds. So if people have the same genetic pool and they eat the same way, they drink the same way, they live in the same areas that their um, ancestors or previous generations lived, it is highly likely that they will get the same things, right? So, because of this age of information, we can do better in that we can choose to live in an area where the skies are blue versus the smogginess of the metropolitan areas. We can choose to eat organic over things that are laden with pesticides. So I think that is still important in every case. But the hereditary predisposition syndromes, I think if you have a concern, discuss that with your doctor, and together you can evaluate to say, is genetic testing indicated? And what does that mean? What does that offer in terms of increased amount of screening, as well as can you take some actions that will further prevent that person from developing cancer if they do test positive for a genetic mutation.
Okay, so there's also a limitation of insurance. But if you have family members who are young when they develop cancer, like sister, brother, mother, father, below the age of 50, and if you yourself have had multiple cancers, definitely I agree that you should go to your physician and consider asking for the genetic testing. Although, like you said, the actual genes are in a minority of patients, but
Totally.
it's more the lifestyle that can be changed.
Yes.
I believe there's a stat, is it 40% or 60% of cancers from or more from lifestyle?
Yeah, we would say 70% of
Oh, okay.
cancers are preventable, right? And that's
Yeah.
based on some lifestyle modifications. And we
Okay.
want to encourage those
Okay.
as much as possible, right?
Right, right. Okay, so I have a quick question about vitamin D.
Mm.
The vitamins out there in the past have not been shown to be helpful in preventing cancer. And like the vitamin A story, vitamin A supplements have been shown to actually increase risk of some cancers, especially in smokers. So, but vitamin D story is not out, is not complete. And I was just wondering
Correct.
what you're telling your patients now about vitamin D.
Well, we're telling patients that you're right. The studies are still ongoing, so there's no definitive answer now. Though when you look at some of the systematic reviews, there might be some associations that have been made with vitamin D and reducing your risk of cancer. Um, in particular, I looked at one study recently in which was a systematic review from 2022 that looked at 50 different trials that had been published regarding vitamin D supplementation. And according to that, vitamin D supplementation was not associated with all cause mortality. In addition, they looked at vitamin D3 versus vitamin D2
Oh,
and
I'm
felt,
sorry. Are you talking about supplements or levels?
yes, vitamin D
Oh,
supplements.
okay. So the
Supplements.
pills that people are taking. Okay.
Yes, because
Mm-hmm.
you know we have told patients don't have this amount of sun, put on sunscreen, don't put on sunscreen, etc. And that is us. Medicine has changed, has evolved, and sometimes it gets confusing. What should we do? What should we not do? So over the years, people have sought, can I get this in a pill? Can I avoid the sun? Get this in a pill? And there's a ton of studies, and I think we have several ongoing at MD Anderson in particular with regards to vitamin D supplementation. And some are stating that vitamin D3 can be supplementation can be associated with a decrease in cancer risk. However, more studies are needed because there's equal amount of studies that say there is not an association. So I think the studies are ongoing to prove that there's some anti-carcinogenic properties with vitamin D supplementation. And I think that is an area that is booming and more to come.
Okay. All right. We will stay tuned.
Yes.
Okay. I I would Dr. Lonzetta, can you say a word about alcohol use and tobacco while you're at it with our young, especially with our younger listeners? It seems like after the or during the pandemic, there was an uptick in the popularity of alcohol. Um,
I
any
think
words?
because it's legal. And I think because it's legal, um, unlike the illegal substances, where there's some repercussions of you having that in your possession, as opposed to you can go into any one of the wine stores and buy wine and have at your leisure, and we've been promoting such. However, from a medical standpoint, to the young listeners and those who are hearing our voices at this time, alcohol does not do the body good. It increases your risk of developing a number of cancers, which is why there are current recommendations of no more than one alcoholic beverage per day for women in particular. One alcoholic beverage serving is defined as 5 ounces of wine, 1.5 ounces of whiskey, 12 ounces of beer. So I caution patients and advise them all to measure it out so you can really see how many servings of alcohol are you getting per day. Furthermore, alcohol has been linked to it's considered a carcinogen and is linked to a number of cancers. That includes head neck cancers, the mouth, the throat, the larynx, the pharynx, the esophagus, the colon, the rectum, the liver, and breast cancer. So, with that in mind, I caution patients, especially, we've been taught in med school that if patients tell you they've had 3 drinks, it's likely more than the 3 drinks.
You just double the number.
Yes, so you want to caution patients. So I tell them, you measure, and then you can gauge for yourself. Now, let's talk a little bit about that. So when we use alcohol alone, that's one carcinogen. And when you combine alcohol with other carcinogens like tobacco, you further increase your risk of developing some cancers. In particular, head neck cancers is quite concerning, and esophageal cancers when you start combining those carcinogens. The other carcinogen I'm going to introduce, even though you didn't ask me about it at this time, is HPV, right? Because that's a virus. But when you combine alcohol, tobacco, and HPV, you're adding all various layers, right? That can further increase your risk, all of which are directly linked to lifestyle modifications and goes back to preventing 70% of the cancers that we're seeing. So yes, we need to educate more, and there's nothing good that we can say in regards, medically speaking. We should counsel our patients not to drink alcohol, not to consume that. And if you are going to consume, measure and no tobacco use.
Okay, I thank you for that, Dr. Newman. You have the gravitas and the knowledge, and to hear you say that is different. Like if mom said it.
Yes.
Okay.
Yes.
Do you have children?
I am a mother as well. Yes.
Okay.
So when you said that, I am a mother as well. So I totally understand that. Sometimes somebody else needs to say that, then it becomes more valid than your parents, right?
Yes. Okay. So we're just about out of time. You did touch on the HPV virus, which is at this point preventable as well with vaccines. Worldwide, viruses are a tremendous source of cancer and hepatitis in particular, hepatitis B and C. Any quick word about vaccines?
I think, yes, people need to get vaccinated. Think about vaccinations not in terms of giving them a privilege or exercising their rights to have more sexual intercourse or encounters, if you would, but utilizing vaccines as a prevention of cancer, saving their lives, giving teens and young adults make different decisions compared to when you have gained some wisdom in your life. So I think as healthcare professionals, we have to impart that knowledge that some of the things that you might engage in, how that adds to your risk of developing cancers in the
Right,
future.
right. So
So
cervical cancer is advanced cervical cancer uh, is not a good thing
it is
at
not.
all, and difficult to treat.
Mhm.
All right. So now for the fun part. Can you tell me about yourself? I mean, like I said, I was just
Oh
so
God.
excited to discover you. And you are, oh, I can't say I'm a fellow Louisianan. Since I was born in Seattle, grew up in California, spent 15 or so years in Houston, but I've been in Louisiana for the past 25 years. So, fellow Louisianan, tell me about
Yes,
yourself.
yes. So I grew up in a small town in Louisiana. And so the beauty of that is when I grew up there, no,
Opelousas.
yes, nobody ate in my community. And furthermore, a smaller community called the Plaisance community.
Mm.
Everyone ate from their garden.
Oh,
Everybody had a garden, right?
oh,
So
okay,
what you did not grow, um, cousin Joe had it growing in their garden, and you
okay.
swapped, and then you stored things like, canned preserves. You stored or uh, preserved enough okra to get you through the winter, etc. So growing up for me was a great time in that all of those things were helping to reduce my risk of developing chronic disease. Little did I know that at that time, right? And I would come full circle back to talking about eating healthy, living on the land, and growing things in its natural state. So I grew up there, graduated from Xavier University in New Orleans, um, and then attended UCLA Drew School of Medicine. At that time, it was combined, and Charles Drew University of Medicine and Science is now exclusively by itself for the first time this year. So, uh, spent 4 years in California and then came to Houston. And I have been in this area, I guess, since what, 1997. So,
Okay.
and frequently go back and forth between Louisiana and Texas based on my family still residing there. But
Okay. Okay. Are they a fan of your plant-based recommendations?
uh, they understand that they are, and I can go home on any given day, and my mom would say, "Oh, this person just brought some mustard greens," or "This person
Okay.
just brought um, green onion and garlic," or and it tastes so different from what you
Mm,
buy in the grocery store. So
okay.
then you start really questioning a lot of things to say,
Mm,
why does this taste different?
mm.
Um,
Probably
this time
because
of the
it's
year,
probably just picked so early, I guess. I don't know.
I
I was
think,
shocked to find out recently that some of those oranges are not really orange. They just put dye in it.
and some of this is frozen and then defrosted for us. Things are sitting in those big bins somewhere, metal containers, then freeze things, then bring it back to the public. This
Mm,
is not so. You should
mm.
not be able to have all of these things all year round. And I think if we just get back to the
Well,
basics.
I'm okay with frozen vegetables because sometimes, let's say you're a single person, it's hard to finish a bunch of stuff by yourself.
Frozen
Yeah.
vegetables, but not frozen citrus products.
Oh,
Sometimes, when you're
oh, oh.
freezing and unfreezing, and then you go
Mm.
into the grocery store, it's all soft and mushy. I
Oh,
did not know the extent.
they freeze citrus products?
Yes. And then bring that back sometimes to the
Oh,
public. And you're wondering why it
oh,
feels the way it does. So I
oh.
think ask more questions,
Hmm.
And I think the public will be able to demand more if we ask more of those questions. And it will get us back to eating more cyclical based on whatever the season is.
Okay. All right. Well, thank you so much. Any last words for our listeners on cancer prevention, or inspire young people to follow in your footsteps?
Oh, in the words of Imhotep, let food be thy medicine, medicine is thy food. Please ask more questions, eat more plant-based foods the way nature intended, and then we will all reap the harvest.
Oh, amen. Okay.
Thank
All right.
you.
Well, thank you so much for your time, and I really appreciate it. And until we meet again.
Thank you for having me. Have a great day.
Thank you. Thank you, Dr. Lonzetta Newman. I challenge our listeners to decrease their risk of cancer by: number 1, plant-based nutrition; number 2, decrease or eliminate alcohol intake; number 3, vaccinate our youth against HPV, which causes 90% of cervical cancer and many oral cancers. Treat hepatitis C, which can cause liver cancer. Treat or prevent H. pylori, which can cause stomach cancer. Ask your primary care provider about it, especially if you have ulcer symptoms. Number 4, exercise and maintain ideal body weight. See the American Cancer Society recommendations for early screening, and note that smoking still causes 30% of cancer deaths. Remember, this podcast is for educational purposes only and does not substitute for advice from your healthcare advisor. This is Dr. Christine Ince, wishing you a balanced mind, body, and soul. Please like, subscribe, follow, and comment. Thank you.